Ladies and gentlemen, before we start to the presentation and in order to avoid any disturbances during the presentation later, I would like ask you to change the mode of your gadget into silent. Let's do it together. Thank you. To Honorable, to English lecturer Mrs. Desi Nurmulyani Sari, Master of Arts, to fellow students, to ladies and gentlemen. Good morning. Assalamualaikum warahmatullahi wabarakatuh. First of all, let me introduce myself. My name is Gabriel Stefani as moderator. Hopefully, all of you are in good health. This morning, we will deliver a presentation of antenatal care. In this occasion, we shall have outstanding presentation, as will improve your insight and knowledge about today's themes. Before the presentation begins, allow me to introduce the presenters. Our presenter is Mrs. Tasya Adilla. Our second presenter is Danica and our third presenter is Enggel Leli Utami, and our last presenter is Mrs. Asri Fadilawati. Okay, without further ado, I would like to welcome our first presenter. She will deliver a presentation about definition of antenatal care. Please welcome Mrs. Tasya Adilla.
Definition of antenatal care. Antenatal care, or ANC, is a service antenatal care is given to pregnant women. Service is carried out to prevent childbirth and to prevent, solve, and detect problems which may appear during pregnancy. According to the Indonesian Ministry of Health 2005, in Rukiah and Yulianti 2014, defines that antenatal care is an examination health is done to check the condition of the mother and fetus, periodically followed by effort to correct deviation was found. In a sense, pregnancy checks are preventive care and aims to prevent things that are not desirable mother and fetus by Purwanisi and Padmawati 2010. Thank you very much.
Okay, let's give once again a big round of applause, Mrs. Tasya Adilla. Now, let's welcome our second presenter. She will deliver a presentation about the frequency of antenatal care visits. Please welcome Mrs. Danica.
Okay, I will be explaining the frequency of antenatal care visit. Ideally, pregnancy checks should be done at least 4 times. ANC indicators according to Riskesdas 2013. Namely, the first visit, or K1, is done once in the first trimester, starting at 0 until 13 weeks. This pregnancy check is done once and usually lasts 30 until 40 minutes, such as physical examination, maternal medical history, and etc. The second visit, or K2, was carried out in the second trimester, starting at 14 until 27 weeks. This examination usually lasts for 20 minutes by performing anamnesis, laboratory, ultrasound, and etc. The third visit, or K3, was carried out in the third trimester, starting at 28 until 32 weeks. This examination is usually carried out for 20 minutes with the same type of examination as the second examination. And the last, the fourth visit, or K4, was performed in the third trimester starting at 32 until 42 weeks. The pregnancy check is the last examination by taking anamnesis, physical, laboratory examination, and etc. Thank you very much.
Okay, let's give once again a big round of applause of Mrs. Danica. Now, let's welcome our third presenter. She will deliver a presentation about who does the antenatal examination. Please welcome Mrs. Enggel.
Who does The antenatal examination ANC service provider are carried out by medical personnel is general doctor and obstetrician and gynecologist. A nursing personnel is midwives and nurse. ANC service delivery place include puskesmas, posyandu, maternity hospitals, government or private hospital, private practice. By applying the quality and standard of antenatal care examination, there are operational standards known as 70 minimum standards such as height, weight, blood pressure, uterine fundal height, and etc. to improve maternal health during pregnancy. Thank you very much.
Okay, let's give once again a big round of applause of Mrs. Enggel. And now, let's welcome our last presenter. And now, let's welcome our last presenter. She will deliver a presentation about why antenatal care is important. Okay, please welcome Mrs. Asri Fadilawati.
Okay. Fourth, why antenatal care is important. Purpose and benefit of antenatal care. As we know that pregnancy examination is very important because it has many uses, namely, 1. Optimizing maternal health during pregnancy and pregnancy, also fetal health. 2. Monitor the health of the mother and fetus. 3. Detect possible complications early so they can be treated immediately. 4. Optimizing the health of the baby born. And to add information to pregnant women if danger signs of pregnancy occur, such as vaginal bleeding, for example, miscarriage, preeclampsia, premature rupture of membranes or PROM, and etc. Thank you very much.
Okay, let's give once again a big round of applause of Mrs. Asri. And the last topic will be delivered by Mrs. Danica Frisky.
For all pregnant women, let's do antenatal care. So, it is very important for pregnant women to carry out antenatal care to reduce mortality rates in pregnant women and mortality rates in newborns. And pregnant women can get more appropriate and safe treatment so that they can reduce anxiety in pregnant women because they have a lot of information about their pregnancy. And pregnant women can enjoy their pregnancy happily and are grateful for the gifts that God has given. Thank you very much.
Okay, thank you very much for all presenters for their informative and interesting talk. So, the conclusion is antenatal care or ANC is an antenatal care service provided to pregnant women. Services are provided to prepare for labor and delivery to prevent, overcome, and detect problems that may arise during pregnancy. Conducted by OBGYN, nurse, and midwife. By applying the quality and standard of antenatal care inspection, there is an operational standard known as the 70 minimum standard. Ideally, pregnancy checks should be done at least 4 times, according to Risk-Dash 2013. Namely, K1 in the first trimester, K2 in the second trimester, and 2 visits in the third trimester. It is very important to do because to optimize the health of the mother during pregnancy and pregnancy as well as the health of the fetus. and 2. Monitor maternal and fetal health, and 3. Detect possible complications as early as possible so that they can be treated immediately. And 4. Optimizing the health of the baby born in order to reduce mortality in pregnant women and newborns. Ladies and gentlemen, finally, we come to the end of the presentations. We would like to say thanks again for all the presenter for their informative and interesting talk, and thanks to audience for your attention. Hopefully, the presentations will be beneficial for everybody. Thank you for your attention. Good morning. Wassalamualaikum warahmatullahi wabarakatuh.